Today's webinar is for AMHH and BPHC critical incident reporting in the new DMHA provider portal. It is presented by me, Julia Allen. So first, we're just going to give a brief overview of BPHC and AMHH specific critical incident reporting. So just kind of the why we do incident reporting for AMHH and BPHC programming. Incident reporting provides a mechanism for reporting and responding to critical and sentinel incidents occurring in connection with the AMHH and BPHC programs. The 1915 State Evaluation Team, or SET, is required to send Critical Incident Report, or CIR data, to the Centers for Medicare and Medicaid Services, or CMS, every quarter. For all critical incidents involving members receiving AMHH and/or BPHC services, a corresponding CIR must be submitted with the appropriate boxes selected to indicate that the member is receiving AMHH and/or BPHC services. The SET will then extract this data to submit to CMS. So depending on the setting that the individual resides in, there are different types of incidents that we ask that you report on. So for individuals residing in a residential facility, we ask that you report on things like medication errors that result in consultation with the poison center, hospitals, or urgent care, or if they result in a death, seclusion and restraints, suicide attempts, serious bodily injuries, deaths, fires or explosions requiring a local fire department response, law enforcement involvement, emergencies that render the residence temporarily or permanently uninhabitable, physical abuse, sexual abuse, or emotional abuse, neglect and/or self-neglect, exploitation, including financial exploitation, elopement, or anything else that you may think needs reported on. It is important to note for AMHH and BPHC programming, which is only for those age 19 and older, elopement would only be reported on if the individual has like a legal guardian in place. And then for those receiving outpatient services, we ask that you submit incident reports for, again, if they have a medication error resulting in a consultation with the poison center, hospital, or urgent care, or if it results in their death, seclusion and restraints, suicide attempts, serious bodily injuries, death, law enforcement involvement, physical, sexual, or emotional abuse, and again, neglect and/or self-neglect. When you're submitting if you select death as an incident type, it will ask you, it'll populate some boxes to get a little bit more information on the type of death, if that is known at the time. And then with BPHC and AMHH programming, we do have required timeframes for when an incident report should be submitted. So for residential reporting, that is within 24 hours of the provider becoming aware of the incident. And for those like with outpatient or home and community-based services, that is 72 hours of the provider becoming aware of the incident. The exception is deaths, all which must be reported within 24 hours of the provider becoming aware of the death. A bit more information for critical incident reports on deaths. Again, regardless of the environment that the individual resides in, reporting should be completed within 24 hours of the provider becoming aware of the death. The type of information that we want you to include in the description of events would be when the clinician became aware, any circumstances that are known surrounding the death, if known, the cause of death, and if the cause of death is unknown, please state so. And we ask that you do not copy and paste the individual's obituary into the description box. Also important to note, all agencies should conduct an internal review for all deaths that occur. In this next section, I'm going to take you slide by slide through the steps to complete a critical incident report in the new DMHA provider portal. Okay. So once you're on the provider portal main page, there is the ribbon up at the top with different drop-down options for you to select. you'll choose critical incident reporting, and you will choose the option to report a critical incident. Once you select that, it's going to take you to a list of all facilities that the provider has that is currently credentialed or certified. You will select the relevant facility. Just for the purposes of this example, there's only one, but I'm sure for all of your agencies, there are a lot more listed. So you'll select the facility and then press Next. After you select the facility, it's going to ask you to choose which type of reporting that you would like to complete. For purposes for AMHH and BPHC programming, you will choose either residential reporting for those residing in a residential setting, or block grant outpatient for those who reside in their own private or independent setting, but only receive home and community-based services. So once you have your setting type selected and you move on to the next page, it's going to ask you to select the type of incident that occurred. Again, you'll choose from all the relevant incidents that were listed on the previous slides. Once you have the correct incident selected, you will then press Next. After this, it's going to ask you about the date and time that the incident occurred and ask you to give a description. It's important to note that this is where you report the date that the incident occurred for the client, not the time that the provider became aware of the incident. And in the description, we ask that you provide a detailed account of the incident, as well as any relevant context information. Again, for deaths, we ask that you please be sure to include when the clinician became aware, any circumstances surrounding the death, the cause of death, or if the cause of death is unknown. You'll see there is that box, are you reporting this incident outside of the required time window? And I'll go over that in the next slide. So if you do check that box, right, if the date that you're submitting the incident is outside that 24 or 72-hour period for when the incident occurred, a new box will auto-populate asking you to provide an explanation for the late submission. Here is where you'd include information like, say, the provider did not become aware of the incident until after the fact. So you would include details here on when the provider became aware of the incident. And then we will use that time frame to judge the 24 or 72-hour time limit was met. And once you have all of that relevant information selected, you'll choose Next to go to the following page. Here is where we're going to start giving information for the individuals involved in the incident. Since this is for AMHH and BPHC programming, usually best to start with the patient/consumer information. So once you select the individual, it's going to the following pages will gather a bit more information on that individual. First being their demographic information. So here on the following page, you would provide their first and last name, their date of birth, gender identity, ethnicity, and race. Anything that has a red asterisk mark does need to be completed before you can move on to the next page. So once all the demographic information has been completed, it's going to ask for some treatment information. The first section is going to ask about the diagnoses that the individual has. If you know the ICD-10 codes off the top of your head, you can use the search bar and search for it directly, and it will narrow it down. Like for here, I just chose F41. It shows me all of the relevant F41 diagnoses, and I can check the box to select that. If the individual has multiple diagnoses, you will continue to search for those. So if you, again, know their ICD-10 code, just delete the information that was submitted into the text bar and press enter, and it will reset your search, and you can start looking for and clicking off all other relevant diagnoses. And then the next sections go over medical information. We ask that you report any significant health conditions that the individual has. And we ask you to please describe the patient's treatment in the month prior to the incident. This could include things like absences, changes in their behavioral plan, frequency that the patient was attending counseling, or any new exceptions that could be relevant to the incident that occurred. And then finally, we ask that you report on when the client was last seen for services. Once all of this information has been submitted, again, you'll press the next button to go on to the following section. Um, in this following section, we're going to go over the medications that the client is currently taking. So these do it one at a time. So you'll start with their first medication, give the name, whether or not it will have a drop-down option for yes or no, whether the medication was prescribed by an outside agency. And then it's going to ask if you know what the medication was used for. Once you have all that information for the first medication down, you'll click next. And the following page is going to show you a list of all medications that you've submitted. So say if the individual is taking multiple medications, for the question, do you want to add another medication? You will select next, or you will select yes. And then when you hit the next button, it's going to take you to another blank medication page where you'll do everything you did in the last slide for their second medication. You'll continue doing that until you have all of the medications listed. Once you're satisfied with that list, you will select no, and it will move you on to the following section. This next section is going to be asking if the individual has any pending legal charges. So the first question, were there pending legal charges related to the incident? If you select no, the first box that's in red will not auto-populate, so it's not there when you first enter the page. But if you select yes, it will ask you to please list all pending legal charges. And then it's going to ask about precautions prior to the incident, so including if there is a safety plan in place. So if there is a safety plan in place, please describe how it has been used to help kind of prevent the incident. And then the following question, was the individual on an involuntary commitment at the time of the incident? If you select yes, these next two boxes will auto-populate. If you select no, they won't appear at all. But if you select yes, it's going to ask you to, it will have a drop-down option of different commitment types. You'll choose the one that's relevant to your client. And then it will also ask for the date of the hearing. Once all of that is completed, it's then going to ask for, it's going to have a list of services that the individual may be receiving. This is one of the most important sections. So if your individual is receiving AMHH or BPHC programming, you need to be sure that these boxes are checked. If they are not receiving AMHH or BPHC services, please leave these boxes blank. Once you have all of that information down, it's going to take you to a list of all the individuals involved. If there's only one individual involved in the incident, you'll select for this question, do you want to add another individual to this incident report? If you select no, it's going to take you on to the next section. If you select yes, it's going to populate those past couple of pages again for any other individuals involved in the incident. And then we're getting close to the end. It's going to ask if the agency will be completing an internal review based on the incident. And again, if you select no, it's not going to populate anything, but if you select yes, it asks you to please provide an incident resolution or plan of action. And again, all deaths require an agency internal review. It's also going to ask if, based on the incident, if an endangered notification will be submitted, and it will ask either about adult protective services, child protective services, or law enforcement. If you select yes for any of these options, a page will auto-populate after this to obtain additional information. So purposes for this presentation, I did select yes for APS services, and it would look a little bit like this, or not a little bit, it'll look exactly like this. It will ask for the date that the APS notification was sent, as well as a report number that is tied to that case. And again, if you have multiple APS, CPS, or law enforcement, it will have a page for any of those that you selected. And then it's going to start asking for information regarding the agency and the people who submitted the form. So if whoever is entering this information into the DMHA portal, we ask that you include your first and last name. And then as like a digital signature, it's going to have you include the date that you completed the incident. And then say the person submitting the incident, maybe if you've got like other people who we should follow up on, should we have additional questions about the report that was submitted, here's where you will submit the agency contact information. And that includes first and last name, the contact phone number, as well as an email address that we can use. And then once you hit next, it's going to take you to an overview page. It's going to show you all of the information that had been submitted into the report thus far. And it's going to give you down at the bottom a drop-down option to either review and modify or submit your incident. If you look at the overview page, you realize something's incorrect, you can choose from the drop-down menu. You can either review or modify incident details, review or add individuals, or review endangered notification details. If you select one of these, once you have that option chosen and you hit next, it's going to take you back to those relevant pages. And I think from there, you'll be able to, like, say if you do review or modify incident details, it'll take you through like pretty much the full report again. But if it's only the individuals that you want to make adjustments to, or the endangered notification, you can go to those sections in the middle of the report as well. Once you've updated and made your changes as you need, and you're ready for the incident to be submitted, you will choose the drop-down option, Submit Incident Report. And from there, you will hit Next. This will show that the report has been completed, so you'll know your report has gone through once you get the page that states your critical incident report has been submitted and will be reviewed by DMHA. From there, you can click the home screen to go back to the main page of the provider portal. If you need to check up on the incident, if you want to see where it's at, from the blue ribbon up at the top for critical incident reporting, you can choose the option to view my incident reports. And here you can see all of the different test incidents I've done. It's going to show you a list of ones that are still being worked on, still in draft status for unsubmitted. And for the ones that you have submitted to DMHA, it's going to list them. It'll show the facility, and then it's also going to show the status of review that they're currently in. So you can keep track of kind of how the incident report is being processed. If at any point in time, as you are going through your incident, if you have questions for BPHC or AMHH specific CIRs, you can contact me directly at julia.allen@fssa.in.gov. Or you can also email our general inboxes for BPHC or AMHH services. If you have more general portal questions or CIR questions, those are best addressed by submitting a support ticket inside the DMHA provider portal. And that concludes the prepared portion of this presentation. We can now open the floor to any questions that people have.
So Julia, there was a couple questions in the chat.
Yeah, of course, if you wouldn't mind.
Sure. So the first was from Megan Creech asking if there's a way to deselect the time if you are not aware of it.
I would say if you're not aware of the time, put your best guess down or an approximation. And then in that description of events, that's where you will say, especially, yeah, if it's one that like the individual told you in a therapy session and it happened days ago, they're not going to remember the exact time. Put the best estimation down. And then again, in that detailed description of the incident that occurred, you can put in the narrative there that the exact time is not known.
And then the second question was from Alex Beck, stating that some individuals are on 10 or more medications, and is there an option to upload a list of these medications instead of adding them in one at a time? And with reports involving multiple individuals, there could be instances where dozens of medications may have to be put into the report.
Um, at this time, we do not have a mechanism for that, um, but we can definitely make a note of that, and, if that's something that, they're able to make a change to as we continue to work on the portal, we'll make that need known.
And then it looks like there's a question about, will there be a printable version of the report?
I think Jenna might have
Yeah.
the most relevant, yes, information for that.
Sorry. So, yes, we are working on that. I am working with the vendor right now to generate that. Because I think historically in the old system, it gave like a summary, you were able to report that or to print that out. So they are working on that. There will in the future be a summary page once submitted. So you won't get a summary after everything's closed. You'll get it right after you submit it. So it'll basically just be a summary of all the information that you've put in there. So that is in the works for development.
Does anybody else have any questions for now?
I saw that Liz, I think, put a comment in the portal or in the chat. So if your locations aren't showing up in the portal, there's usually two things. Main thing is normally that your certification has expired. So if your certification is expired, your provider will not, or that facility where that credential expired will not be on the list until that credential is approved. Then it populates back on the list because technically it's expired, so it shows it won't put that facility in there for that reason. So that's the likely issue is that, and we have had some, there is been some delay in transition to the system with approving certifications and licenses. Just with the back and forth, not only on our end, I know it on the provider side too, just different kinks that we've had to work through. So the credentials are all backdating to when the expiration is. But it's just that it won't be in there until we actually get those approved. So yeah, I would say just make sure those applications that you're getting the feedback back to the team so that the license and cert team can get those approved. And then the other reason it could be an error. So if you do know all your credentials um, are active, then if you can just put a support ticket in, that helps us to keep track of it. And then if I need to send it to the vendor to have them look at it, if it's not something that I can fix, then the ticket's in there and I can send that to them.
And it looks like there was another question from Katie. Is it possible to view the status of all of my facilities reports rather than just the ones that I personally completed?
So it's not set up that way right now, but I can take a note of that, Katie, as a possible future enhancement, um, if that's something that would be beneficial. Let's see.
Looks like there's another question. Will critical incident reporting remain in the portal? Is there a way to give staff access to CIR without giving them access to the rest of the portal?
So yes, the CIRs are there to stay. We're actually the portal, we're actually looking at more things to add into the portal. We want it to be more of like a one-stop shop for, license certification, CIRs, CSLs, QA. So it's here to stay. We are working on, and it will likely not happen till later this year, possibly into the next year. We are working on a permissions development in the system, that would limit that. The issue that we've run into is there's lots of providers who have multiple access to different providers. So it's not as easy as just creating a separate login. That would have been an easy fix, because some individuals have access to multiple different like provider accounts. We have to now develop that permissions a little bit differently. So it's going to take some time to develop that. So as it stands right now, no, but that is something that we're actively working on and developing that will be implemented in the future.
And it looks like that's all of the questions so far in the chat. Does anybody else have anything else they'd like to ask about?
Julie, I just want to add one thing too. Back to talking about if your setting does not show up, if you have a expired credential for now, I would say in those cases, if you have a death, that still please make sure that you are reporting those to us, whether that's to one of the inboxes for AMHH, BPHC, or to myself. Please just make sure that you're reporting those to us within 24 hours, whether you're able to put that in the system or not. I think those are very important. So we want to make sure that those get reported within 24 hours. So I just want to add that if you're not able to get it into the system, or even putting it in a support ticket, if you're like, oh man, I forget their emails, or, put in a support ticket, say, hey, I'm not able to enter this death, then that at least helps us keep track of that.
Yeah. And yeah, for any incident, if you're not able to put it in at the time, like Jenna said, you can submit a ticket or email us. And then once it has been, once your facility is back in there, you can go ahead, submit the incident as normal. And then in that late explanation box, you can give that description. And again, if we have that you've reached out about the incident, that will not count against you. If we have no further questions, I will let you guys go. Here, let me go back to that contact page. If you have any follow-up questions after this presentation, again, please feel free. You can reach out to me directly, the BPHC or AMHH services inbox, or if they're for more general provider portal questions, you can submit a support ticket. But yes, that will conclude our presentation. Thank you all so much.